Meaning of defensive medicine.
Defensive medicine.
Defensive medicine.
Defensive medicine.
Defensive medicine. Defensive medicine refers to medical practices and procedures that doctors perform not primarily for the benefit of their patients, but rather to protect themselves from potential lawsuits. This often leads to unnecessary tests, procedures, and treatments, which can result in higher healthcare costs and even harm to patients. Defensive medicine can also contribute to physician burnout and a decrease in patient trust. However, some argue that it is necessary due to the high risk of malpractice lawsuits faced by healthcare professionals.